My name is Madison Simons, and I'm a staff psychologist in the Digestive Disease and Surgery Institute at Cleveland Clinic. I was recruited to Cleveland Clinic to build an integrated GI behavioral medicine program in their esophageal and motility GI clinics after getting experience in a psychogastroenterology fellowship at Northwestern. Here at Cleveland Clinic, I participate in both clinical and research work serving patients with chronic digestive diseases. So much of what I do doesn't fall under typical therapist responsibilities, but the part I'm most excited about is I received pilot funding to study glycemic variability, symptom severity, and diet in patients with inflammatory bowel disease. This is the first time that glucose metabolism is being studied in patients with digestive diseases. So this work is exciting, one, because it's not typically done by psychologists, and two, it's never been done before. So it's exciting to be part of that. At our most recent National GI Conference, integrated GI behavioral medicine programs were identified as the mega trend of gastroenterology, or where the field is headed. There are less than 300 mental health providers with specialized training in gastroenterology in the world, and that's compared to nearly 18,000 gastroenterologists in the US alone. And so because we've demonstrated through our research that behavioral interventions are wildly effective at reducing gastrointestinal symptoms and improving patient care, gastroenterologists really want psychologists as part of their team and are excited to have us. So my work is in high demand. And I find this to be a distinct contrast to other even health psychology settings I've worked in before. In my work as a GI psychologist, I see a very tangible difference of the work that I do in reducing GI symptoms and improving quality of life. So we can actually see reflux sensations improving, people having a better ability to swallow their food, their bowel habits are improving, they're having less vomiting, less diarrhea, less constipation. And that's what makes my work feel really exciting. I also love being involved in clinical research, as it puts me at the cutting edge of identifying intervention targets for gastrointestinal diseases and then starting to develop what effective treatments might be for these patients. Regent offered me the flexibility to explore and pursue my interests. I came across nutritional psychology in my first year in the program, and then spent a significant amount of time developing expertise in this area over the course of my time at Regent. I ended up being recruited for my expertise in nutrition for my psychogastroenterology fellowship at Northwestern. And have now had the opportunity to put my feet on the ground and actually implement the projects that I've been dreaming about for several years, like this current one in glycemic variability. When I look back on my time at Regent, I am so grateful for the immense support from faculty to pursue my personal and professional dreams. Regent provided me the first example of what it could look like to be both excellent in my work and present and engaged as a mom. And so coming from a large public university for undergrad, I cannot overstate what it meant to be valued and believed in for who I am as a person. And that has undeniably changed the trajectory of my career and really shaped who I want to be as a supervisor and as a psychologist down the road.